Hello, my name is Dean Karalis, and I'm a clinical professor of medicine at the Sidney Kimmel School of Medicine at Thomas Jefferson University Hospital. I also serve as one of the course directors and faculty for CVI's Clinical Updates in Cardiology and the Philadelphia Lipid and Atherosclerosis Club. Welcome to CVI Heartbites. CVI Heartbites is a free, non-accredited educational program produced by the Cardiovascular Institute of Philadelphia, featuring succinct presentations delivered by leading experts on timely topics in cardiovascular medicine. This CVI Heartbeat segment focuses on cardiovascular disease in the age of COVID-19. And what I'll be discussing today are statins safe in patients with COVID-19. Please note that this presentation was recorded on May 21st, 2020, and the information was up to date as of that time. So let's get started. Are statins safe in patients with COVID-19? Now, as a background, as of late May, there have been over 1.5 million COVID-19 cases and over 90,000 COVID-19 deaths in the United States. And these numbers are continuing to rise, and there's concern that there may be a second outbreak later on this fall or early next year. We now recognize that risk factors for serious complications from COVID-19 include older age, diabetes, hypertension, and cardiovascular disease. Many of these patients are being treated with a statin or have an indication to be started on one. We also recognize that it's the hyperinflammatory response to the virus that plays a key role in causing the severe complications associated with COVID-19. And cardiac involvement in hospitalized patients with COVID-19 is common and contributes to 40% of the deaths related to the virus. Statins lower LDL cholesterol, but more importantly, they improve cardiovascular disease outcomes and have anti-inflammatory properties. So could statins have some benefit and reduce the complications associated with COVID-19? On the other hand, LDL cholesterol can fall significantly in patients with acute COVID-19 infections, and the more severe the disease, the lower the LDL cholesterol. So could lowering LDL cholesterol further in patients with active COVID-19 infection worsen their prognosis and lead to more serious complications? So the questions we ask, are statins safe in patients with or at risk for COVID-19, and can they reduce the complications of COVID-19, are really important as we go through this pandemic. So how could statins reduce inflammation and improve outcomes in patients infected with COVID-19? Toll-like receptors are an important family of sensor proteins that play an important role in the innate immune system. When a virus enters the body, toll-like receptors recognize that virus and then activate the immune system. Activation of MyD88 leads to a pro-inflammatory response with an increase in inflammatory cytokines to help fight the infection. To balance that, activation of TRIF actually suppresses inflammation and suppresses viral replication. In animal models, statins have been shown to blunt this inflammatory response by activations of MyD88. So the mechanism by which statins may improve outcomes in patients with COVID-19 is by blunting this hyperinflammatory response that we see that occurs with COVID infections in patients that lead to these serious complications. Now, some studies have shown some positive results. In one study, and in the study on the left, in over 3,000 patients hospitalized with laboratory-confirmed influenza, patients treated with statins had a lower odds of death than those not on statin therapy at 30 days. In the study on the right, in a much larger population of over 1 million statin users, statin use was associated with a small but significant protective effect against hospitalization for pneumonia, 30-day pneumonia death, and all-cause death related to influenza. However, these protective effects were substantially attenuated after controlling for confounding variables. In a recent study among hospitalized patients with COVID-19, about 10% were taking a statin on admission. And statin users had better odds and greater odds of both being discharged from the hospital and surviving the infection than non-statin users. Now, these observational studies need to be interpreted with caution. They're non-randomized and they're observational. But what these studies do tell us and should give us confidence is that statins can be used safely in patients who are at risk or who have active COVID-19 infections. So to summarize, what are we to do as clinicians and as physicians with regard to statin therapy in patients who may have or are at risk for COVID-19? First, we need to inform patients that statins are safe, but they may cause muscle symptoms that mimic the symptoms of COVID-19. However, the more common symptoms of cough, fever, and shortness of breath are not associated with side effects from statins. And that should be able to allow the clinician, along with the availability of more rapid testing, to either exclude or make the diagnosis of an active COVID-19 infection, should help us being able to distinguish between symptoms of COVID-19 and side effects related to statin therapy. In the era of COVID-19, statins should be continued to be prescribed when indicated by current guidelines, because statins reduce cardiovascular risk and prevent cardiovascular events. For patients with uncomplicated COVID-19 infection, statins should be continued. For hospitalized patients with COVID-19, continuing the statin should be weighed against the risk of rhabdomyolysis or liver dysfunction that may occur in severely ill COVID-19 patients. So what do we know? We know that statins reduce cardiovascular events and improve cardiovascular outcomes. Whether they reduce the complications associated with COVID-19 is uncertain and unclear. However, what we do know is that the observational evidence, along with that from patients infected with other coronaviruses, provides support for the safety of statins in the era of COVID-19. If you have any questions related to this presentation, email the CVI at cvi.markhartnett@verizon.net, and they'll forward those questions on to me, and I'll get them back to you with answers. I want to thank you for participating in this program, and for more information on other CVI Heartbite topics and upcoming programs, please visit us at cviphiladelphia.org or follow us on Twitter at CVI Philly, #CVI Heartbites. Thank you, stay safe, and stay well.